Welcome back, healthcare professionals. Today, I'm diving into the essentials of immediate newborn assessment and care. First off, let's talk about the Apgar Score is a quick test done at 1 in 5 minutes after birth. It evaluates appearance, pulse, grimace response, activity, and respiration. Each criterion scores from 0 to 2 with a maximum of 10. For instance, a newborn with a heart rate of 120 BPM, a good cry, active motion, prompt response to stimulation, and a pink body with blue extremities would score a solid 9. Next up is, newborns lose heat fast and are at risk of hypothermia. Drying the baby immediately, placing skin to skin with the mother, and using warm blankets or a radiant warmer are key steps. Imagine a newborn placed on the mother's chest, dried thoroughly, and covered with a warm blanket. Simple yet crucial. Is another vital step. Suctioning the mouth and nose with a bulb syringe or suction catheter clears any obstructions. If a newborn struggles to breathe, the healthcare provider gently suctions the mouth and nose to clear the way. Now let's discuss. Positive pressure ventilation, or PPV, may be necessary if the newborn isn't breathing well. In severe cases, endotracheal intubation might be required. Picture a newborn receiving PPV with a bag valve mask until spontaneous breathing kicks in. Involves clamping and cutting the cord a few minutes post-birth. Delayed cord clamping around 1-3 minutes allows more blood flow from the placenta, boosting iron stores and hemoglobin levels. The provider typically waits about 2 minutes before clamping and cutting the cord. Identification is critical. Placing ID bands on the baby's wrist and ankle, along with matching bands for the mother, prevents mix-ups. A nurse quickly places matching ID bands on the newborn's ankle and the mother's wrist right after birth. For a single intramuscular dose prevents vitamin K deficiency bleeding. Typically, a nurse administers 1 milligram of vitamin K intramuscularly to the newborn's thigh, ensuring safety from severe bleeding. Prevents bacterial infections like gonorrhea or chlamydia, which can cause blindness. A nurse applies erythromycin ointment to both of the newborn's eyes once the baby is stable. Early is encouraged within the first hour of life. This promotes bonding and provides colostrum, rich in antibodies. A lactation consultant often assists the mother in positioning the newborn for that crucial first breastfeeding session. A thorough checks for congenital anomalies, birth injuries, or other issues. A pediatrician examines the newborn's entire body, ensuring everything is as it should be. For at-risk infants is essential. Newborns with a diabetic mother, preterm infants, or those with intrauterine growth restriction need close monitoring. A simple heel prick test helps keep track of the newborn's glucose levels. Lastly, administering the within 24 hours of birth protects against hepatitis B infection. A nurse typically gives the first dose in the delivery room before the baby moves to the postpartum unit. Immediate newborn assessment and care are critical to ensuring a smooth transition from intrauterine to extrauterine life. Properly executing these steps can significantly reduce neonatal morbidity and mortality, laying the foundation for a healthy life. Thanks for tuning in. Don't forget to subscribe for more vital healthcare insights.